Hi, I'm Dr. Dave Novanek of Doctor's Choice Physical Medicine and Rehab in Pottsville, Pennsylvania. One of the most common questions I get from some patients is, Doc, do you think I can qualify for disability? And that's a hard question to answer. So I'm going to give you everything I know about qualifying for Social Security disability, at least as it relates to the spine problems. Now, one of the first things that they're going to look at is your age. So obviously if somebody has the same type of spine complaint and somebody's 25 and somebody is 60, the 60-year-old is more likely to get disability than the 20-year-old. And that's simply because the 20-year-old has a lot more working life to work. Now, another thing that might look at is how the retrainable ability of the patient. So if you have somebody who's not that trainable and they're 60, they're more likely to get Social Security disability compared to somebody who's 20 and is retrainable. Okay, a 20-year-old might be able to do a different type of job. And they'll also look at what type of job you did before. The more manual or harder the job was that you did, because they like to get you back to the job that you did before. Now, another thing that's pretty important is what shows up on the medical side of the equation. So for a spinal problem, if you're going for disability for a spinal problem, they're going to look at such things as, what type of medical problem you have. So most of the time for a spine problem, they're going to want to see an MRI. So they want to see herniated disc or some type of spinal problem that's objective on the MRI. Another thing they're going to look at is an EMG test. That's a nerve test. And they'll want to see if there's a pinched nerve or not. Okay. Third thing they're going to look at is what attempt did the patient make to recover from this injury. They don't want to see a month's worth of treatment and then go for disability. Typically, they're going to want to see maybe a year's worth of treatment and different types of treatment, medication, maybe surgery, and maybe conservative care like chiropractic and physical therapy. So a lot of the stuff from the medical side is in this book from the AMA. It's the Guidelines to Evaluation and Permanent Impairment. So a lot of the studies they'll look at that, let's say, for range of motion. And recently the AMA changed what they're doing, and they're recommending that they do a dynamic EMG or a dynarom for the range of motion. And this is, again, a book from the AMA for range of motion assessment. And this, if you can see this picture right here, this person is not only doing a range of motion on their neck, but they have wires connected to them. And what they're doing is measuring the electrical signals off the muscles as he's doing the range of motion. So just think of this as you're getting an EKG for your heart. So with that, they're putting little sticky electrodes on your chest, and they're going to record electrical signals off your heart muscle as it beats. And there's a certain pattern that you should see. And the same thing's true with your back. So with this dynarom test, we're going to put electrodes on your back, and we're going to have you bend forward, bend backwards, side to side, and rotate. And there's a certain pattern that we should see when you do all that stuff. So if there's an abnormal pattern, that could tell us whether it's an acute injury or a chronic injury. And if that pattern's been there for a year, you definitely have a chronic type of problem. One of the things that we'll look at is called a fasciculation and fibrillation. And that shows up on this EMG test as a jitter when you're moving. So the movement that you should do with the dynarom test, the electrical signal should be very smooth as you bend forward. It shouldn't be a jittery, and we call it pattern. So this is something that would be very helpful to a case for a back or neck problem. So if you want to know more about disability are interested in the Dynarom test that we do at this office, in fact, we're the only office in all of Pennsylvania that's certified to do this test at this point. You can give us a call at Doctor's Choice in Pottsville, Pennsylvania at 570-622-2525. Thank you.